As long as y'all are going to stay back there, I'll lower my mask because I know it's kind of hard to understand. Um, so anyway, guessing we're here. We've seen a little uptick in COVID in the area. A lot of folks have actually called and asked me, one, what are the numbers? Number two, why? So we started noticing a few weeks ago that the positivity rate in our system, which would include Albany, Maryville, the LTAC here, was going up. Our positivity rate that last week was it was 11.9%. The week before that it was about 10.5. So we had noticed this trend, and the week before that I think it was 8 or something like that. So when the positivity rate goes over 5%, our numbers are going to go up inside the hospital to above 5, which, as you all know, we had been running really around 5 patients or less. A couple of times even got down to 0. So the last few weeks we've been seeing this, and the question's why? Why are we seeing this uptick? Well, one, people are getting out. It's warmed up. We've had graduation parties. People are having bigger gatherings, and our vaccination rate is low. If you looked at what our county's vaccination rate was, comparatively around the state, the counties around here have a lower than average vaccination rate. And so that puts you at risk. We need to, still be vigilant. We're not done with this. We're not done with COVID. It's here to stay. So we need to be vigilant. If you're going to be, and I don't say don't go to the store, don't get out, but if you're going to be out, wear your mask. Use good hygiene. If it's going to be a real crowded area, be thoughtful about the gatherings you're going to be going to. But more than anything, we need to get people vaccinated. I know there's still some reservations, but vaccinations work. We have had a couple of patients that did get admitted who had been vaccinated, which would be consistent with what everyone has seen across the nation. These folks have only been in the hospital for a very short period of time, and none of them had required ICU. So if you'd been fully vaccinated, some did get COVID, some came into the hospital, they were here for a few days, they've gone home. They've always been on the 5th floor. Today we have 10 people in the hospital. 8 of those are on 5. I believe we have 2 in our ICU at this particular time. I would expect a little bit more of an uptick in the number of admissions that we're having, just because we're seeing that positivity rate, closer to 12. We are also wondering about variants. We have sent some tests off to the states. If you contract COVID and you've been fully vaccinated, we do send a test off to the state. However, the state has not released the results. You have all heard about the 2 counties here in Missouri that had a very high positivity rate. It appears to be the Delta variant. Now, the state will give better numbers and more clarity on that. I just don't know when they're going to finally release that information and which one is the majority, because several weeks ago when they released, we did have all 4 variants in the state. At that time, the UK variant was the most prominent, but we're waiting for that update as to which one is actually the most prominent variant. So what I would say to everybody again, is you're going to be out there, use good judgment, good hand hygiene. If you're going to be in large crowds shopping, as you're walking in, put that mask on. You need to wear it correctly, okay? Doesn't work. Really doesn't work. Just strains your ears. So, need to have our mask on, that good hand hygiene. Keep your social distancing where you can. If you know that people, if you're going to be in a gathering and people have been vaccinated, look, we know that you're good to go. Okay, that's not what I'm telling folks, but I'm telling them since our positivity rate's going up, our vaccination rate in the area is lower than what we would like to see. Get your vaccines. If you're a Mosaic patient, please call your PCP so we can arrange for vaccination. The pharmacies local pharmacies have vaccine that you could get on their list to be vaccinated. And, certainly if there's a larger public outcry for vaccine and people start saying we really, really, really want to get vaccinated, then we'll listen and certainly we'll do what we need to do to help the public. But at this time, we are vaccinating kids 12 and up with Pfizer, and those services are being provided through one of our clinics, and we're looking at some opportunities to work inside the city if we see a large outcry for vaccine. We've had some folks have their kids vaccinated. I don't have the numbers at this time.